Eden Care UK is a friendly intervention service providing support to people who are terminally ill reaching end of life. We advocate for a high quality of care and enhanced life choices, and challenge the isolation of elderly people through friendship and social activities. This service would not be possible without your support. Please donate edencareuk.com or call 07957 199 328.
আসসালামু আলাইকুম। ও আমার বোনজি, তাইনোর আব্বা আম্মা নাই, আমারও তো ঠিক নাই বিয়া দিবার। আর তাই তোরারে দিবা নে, আমরা দোয়া করবো নি, তোরা সাহায্য করছো।
National Muslim Burial Register was established to support Muslims arrange their final rites. This service caters for Muslims who have no one to carry out their Islamic burial rites upon their death, including funeral planning and burial after their demise. Get in touch for a friendly chat and discuss our eligibility criteria. muslimburialfund.co.uk or call 07957 199 328. National Muslim Burial Register is a service offered
10 বছর
আর আম্মা
7 বছর
মানে তোর মা বাপ কেউ নাই না
না
তোকে তো বিয়া ঠিক করছেন কোনো
ও ঠিক করছি তো অনেক আজারাতা সাহায্য লাগি রে বাবা আমি থাকি আপনার কাছে আপনার জানি আমি ফুরি গুতারে একবার দিতাম
আমি তোমার প্রিয় হতে চাই আমি তোমার প্রিয় হতে চাই আমি তোমার প্রিয়
আমার নাম জামিলা আমি ক্লাস 7 এ পড়ি আমার আব্বা আম্মা মারা গেছে আব্বা মারা গেছেন 3 বছর আগে আম্মা মারা গেছেন 2 বছর আগে
Hello and good evening and assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome to the Health and Wellbeing Show with NK. Tonight we've got a very special topic, palliative care. And I've got very special guests tonight. It's Dr. Sadaf and Dr. Lodhi, who will talk to us about palliative care. Welcome, Dr. Sadaf and Dr. Lodhi.
Assalamu alaikum. Thank you.
Thank you very much. Assalamu alaikum.
So how is Ramadan going for you? We're nearly like midway. I can't believe this.
Yes.
It's always amazing how much strength you get when you talk to people and they say, you're fasting for this long, but you think, you know what, Allah gives you so much sabr, time just passes.
It does, especially I think towards the evening you get extra energy because you know iftar is nearby. Alhamdulillah. Great. Inshallah, tonight we will talk about palliative care. Shall I start with Dr. Sadaf? Can you tell us about palliative care? What is palliative care?
Yes, sure, Naureen. So palliative care is an approach basically which involves improving the quality of life of patients and their families who are dealing with life-limiting illnesses. So it involves managing their symptoms, which can be anything like pain, seizures, vomiting, anything, any symptom which causes distress. And then it involves psychosocial support and spiritual support, not only to the patients, but to their families as well. And hence this helps in giving them whatever life is left to enjoy that and have a symptom-free, a good quality of life. And this, if you have to ask from my own self what it is all about, I would basically think, I basically feel palliative care is all about humanity. That's all it is. It's all about humanity and how we consider the other person as a human being, and try to, sort of resolve their misery.
Yes. And you yourself are a GP. Do you see like the ethnic minorities taking up much of that kind of support, or is that still on low on numbers because people often don't understand what palliative care is really?
Yes, absolutely. So that is one of the struggles we have. So with the South Asian population or the African populations, we still have a very low uptake of the palliative care. So where I work as a general practitioner in Walthamstow, we still struggle with the Asian families taking over the palliative care because they're is a lot of reliability on religion, which I understand, me as a Muslim as well. But we also have to understand that there are drugs there, 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 there are facilities there which have been brought to you to your service, which you can use to help the symptoms of your loved ones who are in agony. So yes, the uptake is very low internationally as well, and in England as well.
Yes. So I myself work in a hospice as well, in St. Luke's Hospice in Sheffield, and I often find that people don't really realize what palliative care is, and especially when people have been admitted in the hospice, that is actually towards the end of life. I find it very difficult to make them understand. Yes, it's the will of Allah. We as Muslims believe in that, but then if a person is towards the end of life, it's really hard to engage with family members to make them understand that we need to provide a quality of life here. Dr. Lodhi, would you add something
I,
to that?
I agree with that. I think one of the struggles often even starts at the diagnosis stage, because sometimes in our South Asian families, you'll find the family trying to convince you, please don't tell my relatives because it will be harmful to them. And I think it's really important that we should be honest with people and tell them that diagnosis if they do have a terminal diagnosis, because it allows them to plan. Maybe they want to say something to their family members, have a will. The final things that people do are really valuable to them. We need to give them the opportunity to plan whatever they want in addition, so that they can be involved in their terminal care. So as you said, palliative care starts not just at the terminal stages. It can even start at an earlier stage. When someone has a life-threatening illness, we can start talking about palliative care. But when it gets to the last stages, when they're in an incurable stage, we get to the end of life planning. We want to, at an earlier stage, in the palliative care stage, start talking to people, start talking about what would they like to have done at a later stage. Is there any particular wishes that they have? Who would they like to be involved? So when it gets to the end of life stage, we're not having those incredibly difficult conversations in someone who may be ill, in pain, maybe drowsy, maybe sedated. So I think the important thing is have those discussions early so that people can be involved at an early stage. And as Sadaf said, WHO estimates that on a yearly basis, something like 40 million people need palliative care. Now, in developed countries, like we're very fortunate in this country that palliative care services are very well set up. As you said yourself, you work in a hospice. But when we talk about low and middle income countries, the availability is very little. So overall, even though about 15-20% of the people in the world have access to palliative care, in low and middle income countries, the availability is very low.
Yeah. Yeah, I feel that because I have to constantly educate people on what palliative care is. And we were going to move on from this as well to, specialist care, that people, like you said, at the early stage can have palliative care. So they can have specialist care with physiotherapists, dietitians,
Mm,
counselors,
mm,
specialist care nurses, and that they can have the same services. Well, maybe not the same as in the hospice, but community nurses who can come and support them.
mm,
It is better now than what it was before, because people would not want that type of support, because as we know, our Asian families are quite large families. They support each other, but that's not really the case anymore either, because dynamics are different with families. um the next question would be about sedatives. Often I hear people say, oh, we don't want sedatives, because they
mm,
think like the person, the one thing I heard was, oh, it's against Islam.
mm.
If you could just dwell a little bit on sedatives, if you can explain a bit more about sedatives, what really sedatives are, and why we use them in hospices or hospitals.
Sure. Shall I try and answer that? So when we talk about
Please.
sedatives, sure, thank you. When we talk about sedatives, we're talking about a drug which is used either to calm somebody down or to help them go to sleep. When do we use them in palliative care? The important thing about end of life care or palliative care, in particular end of life care, is to make the person as comfortable as possible. We're talking about improving their quality of life at the end of their life. So at that stage, we're using a whole range of medications. We may be using strong painkillers. We may be using sedatives. Both of them can make a person drowsy. These drugs are not being used to make the person sleepy. They're being used to control symptoms. And that's the important thing. We're using them to control symptoms. Because as we've said, at that stage of life, we're not at a stage of trying to cure the disease. We're at a stage of symptom control, trying to make the last few days of their life as comfortable as possible. So it's important to remember that they are commonly used. So when I was looking at the data, the largest study I found was a study in Austria when they looked at a large number of palliative care units. And they found approximately 20-25% of patients are given sedatives in the last 2 weeks of their life. Approximately 3/4 of those have sedatives continuously, and the other quarter have them intermittently. When we look in the UK, it's about the same sort of range, about 28% or so. So why are we using sedatives? As I said, important to control symptoms. So what sort of symptoms? Well, first of all, delirium. Delirium is when somebody becomes confused for any particular reason. I'm talking about an acute confusion. I know you had a talk last week about dementia. So it's not somebody with dementia who's confused, but somebody who's normally quite well, but it becomes confused because they're acutely ill. So they're often used in that stage. They're often used for anxiety. A lot of people get restless, so they're used for restlessness. They're particularly helpful for shortness of breath. As Sadaf said, at the end stages of life, there's a whole myriad of symptoms. And a lot of the drugs that we use work not just across one thing, but they help with other things as well. So we may be using some other drugs for shortness of breath, but the sedatives also help with shortness of breath. They can also help with some sort of pain, vomiting, distress. So multifactorial uses of these sedatives. But what we do know is, A, they're beneficial, and you tend to use a slightly higher dose at the end stage of life. It is not because you're trying to make the person drowsy, it's because the symptoms are getting worse. So you titrate up the dose of the sedatives as needed. As we said, only about 15, 20 minutes, only about 20-25% of patients have sedatives. So not everybody has sedatives. But if you need them, please don't try and avoid them. It's important that the person should be symptom controlled.
Yes, thank you for that, Dr. Lodhi. I think it's really important that we understand the medication, because often you'll have family members intervening for no reason, and then the patient is in awful lot of pain. And like
Mm,
delirium is one of them things that not many people understand. Delirium,
mm,
if you're not a specialist, it's really hard. And I mean, I think for myself, if I would get that ill, I have anxiety as it is. Just imagine that, I would like to have sedatives, but I think this is something really that family need to discuss with each other, because we often have dynamics as well, families arguing over the fact that they are constantly sleeping. We would like to
mm.
talk to them, but it's really hard. So thank you for that. And I think we will go for a short break, and then we'll get back again. Thank you.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم السلام عليكم Balasuni. Balasuni. This is a very interesting story. When we first started our aid work 4 years ago, our sister here, her husband was bedbound and he, disabled. And when myself and the team, we went to their house, it was smelling of rotten flesh. Her husband was very, very unwell, and you couldn't grab him, you couldn't carry him out. He was heavy, and you had to do everything. And in the corner of the house, they had a couple of cows and ducks and chickens, and to support him. And আপনার হুতা হজন সাইড জন এরা বয়স হতো
ইলা না বিচরে একজন ইলা ফুরুয়া কি বড় ইলা গিয়া ওই গেছে ইয়া কবচর 8 বছর আগে গইল গিয়ে 9 বছর হচ্ছে
আচ্ছা
আর একজন 11 বছর
তো আপনার হাজবেন্ড তাই মারা গেছেন নাকি
জি
her husband who we helped passed away, and আমরা হেসময় তো দিছিলাম আপনার খানি দিছিলাম
সপ্তাহ দিছেন
আপনার একটা পাইয়া একটা সাহায্য হয়েছে নি
আল্লাহ আল্লাহ আপনারা দিছেন যে আমি খুব খুশি হয়েছি যে আমার অত সাহায্য আপনারা করছেন।
It was a very difficult situation for all of us at that time, and আজকে আপনারা 4 বছর বাদে আবার আইসেন ইনোর মাঝে যেন রোজার খানি তেল ইনোর মাঝে এটা পাইয়া এটা কিতা বুঝেন এটা বালা নেই
আমরা খাও তো ইফতার করমু নামাজ করমু আপনারা এটা খাইয়া আপনারা লাই দোয়া করুন।
আপনি তো এই একটা মাস আপনার যদি সাইন খাম করতে পারবা নাইলে খানি আছে আপনার পরিবার আপনি তো চালাই জানেনি আপনি হুরতাঞ্চলে স্কুলে ফাটাই রানি। Yeah, this is again another example of why we need to be helping vulnerable people through the rescue center. Sila Aid, we're doing this. Everybody who's helped, I regard everybody who donated for the Ramadan packs, Allah subhanahu wa ta'ala is giving you immense reward, is going to people like her. আপনি যারা দান করছেন যারা এগুলা লইয়া আইসন এরা লাগি আপনি খুব বেশ করে দোয়া করবা তারা কেউ মা বাপ মরছেন কেউ মা বাপ বেমার করছেন কেউ তারা চাইছেন সাহায্য দিতা আপনারা দোয়া করবা তো
আমরা তো দোয়া করব না আপনারা আমরা তখন করছেন যে আপনারা আল্লাহ আমরা লইছো আপনারা করু আল্লাহ তোমাদের লইতা
আমিন আমিন It's a powerful words she has said. She said, you have carried us. May Allah subhanahu wa ta'ala carry you on the day of judgment. It's a powerful.
Welcome back to the Health and Wellbeing Show with NK. Welcome back, Dr. Lodhi and Dr. Sadaf. Before we went on a little break, we were talking about sedatives and how family members are when their loved one is sedated. I've experienced a lot of times that family members have not been happy with the sedatives, but after explaining them, they kind of understand that. And this is something that is going to be in an educational program that I want to do as well for family members in the community, that before their loved one comes to the hospice, that they actually understand what a hospice is. So what could you tell me about the difference between a hospital and hospice? Is that Dr. Lodhi or Dr. Sadaf? Any of you two?
I think I can
I
start on
think
that
Dr.
if that's
Lodhi will
okay.
take that question. Yeah.
Okay, great.
Great.
So,
Great. Thank you. So I think we all know exactly what a hospital is. So I'm not going to talk about a hospital very much.
mhm,
So what exactly is a hospice? A hospice we can think of as a home providing end-of-life care. But I think rather than thinking of a hospice, it's important to think about a hospice care, which is a style of care rather than a building, because a hospice is just a building. But hospice care is more than just that one building. Hospices or hospice care provides a whole range of services. So as we've said, the aim is to improve the quality of life of a person with an incurable disease. So hospices take on that role from the time somebody is regarded as incurable to the time they die. The important thing is not all patients have a progress where they will steadily go downhill. Some patients will actually improve, so they may pop into and out of hospice care. Hospices actually place a lot of emphasis in what's called holistic care, and holistic care is looking after the whole individual, not only their medical problems, that might be their pain, their shortness of breath, but also their spiritual needs, their social needs, their psychological needs, and not just the individual who's ill, but also their family and their carers. And this care doesn't just have to be provided in a building, it can actually start in the patient's home. So, for example, a person's ill, the hospice team may be involved, or the Macmillan team may be involved at an early stage. They may be involved in a care home, so if a person's in a care home. There are a lot of hospices often have inpatient beds as well, so patients may be admitted to the inpatient beds. And a lot of hospices also offer a day center as well. So patients may go in for specific therapies or specific care. When you talk to patients, a big thing that patients tell you is that it feels more like home. It's more comfortable. It's less rushed. Whereas hospital typically has a busy environment. The doctors, the nurses are running around from ward to another. They've only got a relatively short time for you. Hospices really spend time looking after the whole individual. So in addition to having the medical and nursing care, they may well have things like physiotherapy, occupational therapy, complementary therapies, whether that's massage therapy. They often offer rehabilitation therapy. The other thing that they often offer, which is very valuable, is respite care. So, for example, if a family is looking after a loved one and they've been looking after for some time, but they need a short break, the patient might actually go into a hospital just for a short time to just give that short, precious time to the family to basically recharge their batteries. In addition, hospices also provide information about financial affairs, bereavement counseling, so lots of services. And as I said, we're very fortunate to have an extensive hospice network in the UK. The funding of hospices is very variable. Some of them are fully NHS funded. Some of them are fully funded privately by as a charity or donations, and some a mixture. The main aim is always to make the care as comfortable as possible, as close as possible to the patient's home. So you've asked me about the differences between hospital and hospice. So I've spent all the time talking about hospices. So another way to look at it is to think about the traditional care. So if we have somebody who's ill, we can decide, somebody's got an illness of some sort, they're sick. Is the disease curable or not? So if the disease is curable, they'll typically go into a hospital. Let's say they've got a chest infection. They go into a hospital, they get given antibiotics. The aim there is to treat the condition, treat the illness, get the patient better. Whereas a hospice is to control the symptoms, make the person feel better, improve the quality of life. This is a person where we know we can't cure the disease anymore. It's to make the dying process as comfortable as possible. It doesn't mean that they go in and die, because a lot of patients will be able to control their symptoms and get better, and they come back out into the community. But the disease itself is incurable. So hospices are generally, people who use them really have a great liking for them. And one thing you'll always hear is how supportive the staff were. They had time for me. Whereas often people will go into a hospital and come out having suggestions for improvement. It's very rare for people to do that in a hospital, because they just find the care is so well organized. And often they say it's like a family. They get to know all the staff there well. And overall, when we look at the UK, approximately 5-6% of people in the UK actually die in a hospice. I'll give you my own example. When my mother was terminally ill, one thing she said is, "I do not want to go into a hospital. I want to die at home." So fortunately, we were able to help her with that wish. And if you look at the number of deaths in hospital are going down, the number of deaths in hospices, care homes, and home is going up. And I think this is important. Again, as I was talking earlier about giving patients choices, one of the other important choices we need to give patients is, do they have a preferred place of death? We may not be able to achieve it, but let's at least ask them. Only by asking them can we try and help them.
Yeah, absolutely. And I think you're so right. I think so far, the families that actually got into hospices, Muslim families, afterwards, they've actually realized that it was a good place, a good decision to bring their loved ones in, especially if I had a case where it was a father and the daughters were looking after the father. And it gets hard for the daughters to wash the father, to clothe. Yes, we would love to look after our parents, but there comes a state that it's their dignity as well, and it's all about their respect. And I think it's really important that when you are young and well, that you discuss with your family, but if you do come if you become ill, where would you like to stay, or even when you die, how would that process be for you? Because we don't discuss these things. We just sometimes think we're here forever, but we're not. And I think when Muslim families have come into the hospice, I really had to support them and guide them through, introduce them to complementary therapies, all the therapies that are available free of charge for them, they can use. And sometimes I had families that felt bad thinking, no, it's free, we don't want to make use of this because they're already giving us so much support in the hospice. But it's again, it's that education to let people know that if you are in a hospice, like our hospice here in Sheffield, the St. Luke's, is not a respite. We have about 20 rooms, but what we do have is a bespoke service. We'll try to do everything as you want, whether it's spiritual care. It's a very holistic approach, even up to the point that we've had families where the loved one had died and they didn't know how to give the ghusl, and we provided that service. I think with 13 Rivers Trust, I think I must highlight that Eden Care has been amazing, and I've been with them for the last 4 or 5 years. And I think this is support for Muslim families, or all families who with end of life care, with befriending. And I think they've done some amazing work starting in London, and we're trying to move into the north now, supporting families, Muslim families with end of life care. So my other question would be is like, if say, for example, people would like to have that care at home, could you tell them about how district nurses would support them with that care at home, Dr. Lodhi or
Sure,
Dr. Sadaf? Yeah.
Sure.
Yes.
There's a huge
Yeah.
amount of support available. And so at the early stages, the district nurses can do a huge amount of work. That can include simple things like dressing changes, assisting with continence management if they have pressure ulcers, providing medication, taking bloods, providing injections who need them. If people start to go downhill, as we said, it's important to have discussions about where people would like to die. So if people are deciding that they would like to die at home, things like syringe pumps can be set up at home. Fluids can be given at home. There's a huge amount of stuff that can be done in the house. And a lot of the relatively simple palliative care can be done by most GPs. And also, most GPs will have access to a palliative care consultant. Sometimes we have incredibly complex patients. So we have access to palliative care consultants who we can contact and ask for advice. Also, there are specialist nurses like Marie Curie nurses, Macmillan nurses, and lots of areas. For example, in our own area, we have Macmillan nurses who will often go and see patients in their home and have those discussions with them, have those difficult discussions with them at an early stage, and start care planning, start setting up things towards the end of stage of life. So one of the things that we like to do is, as Sadaf said, is palliative care is important in terms of symptom control. And the other thing that she mentioned is not just symptom control, but it's also planning for the future. So if we know somebody's health is going down, and we know they're at the end stages of life, we know there's a likelihood they might need some drugs at the end of life. And typically, and we all know these things always happen on a Friday night in the middle of the night, or on a weekend or a bank holiday weekend when nothing's available. So we always try to anticipate. So we have a whole range of drugs. We call them anticipatory drugs. So we like to prescribe them for our patients so that those drugs are already available in the patient's home. We have specific charts which we can fill in and send. So those charts in the patient's home. So if something happens on a Friday night and the district nurses are called, they can go there, they can assess the patient, and they can start those medication. You're not having to, on a Saturday night, look for a doctor, look for a chemist, look for someone to sign that prescription. So palliative care is not just about symptom control for now, but it's also about anticipation for the future. What's likely to happen and what do we need? And it's not just, as we've said, it's not just the hospice. We've got to try and get the whole team involved. Yes, the district nurses, that may be the palliative care consultant, it may be obviously the GP. And in addition, there may well be a social worker who's needed, the physiotherapist. A lot of these services are also available in the community in addition to hospices as well.
Yes, thank you. And I think the most important thing is that families know as well that chaplaincy is really important. Make use of that. You get a lot of support from that. And I think most of the time people think, yeah, we are with our own masajids, we have our own imams. But if a hospice has chaplaincy care, make sure that people use them. I myself support the chaplaincy team as well. And I think it's really important that when in that hour of need, you have someone who can support you to organize the final rites for your loved one and the care. So I think it's really important that we ask. What do you think, Dr. Sadaf?
Yes. No, I completely agree with you. I mean, chaplaincy is a very important part of the MDT of palliative care, and they provide a lot of support to our patients and a lot of spiritual support. And when we address their spiritual concerns, it gives our patients and their families a lot of strength and even more belief in us. And it helps in something we call the total pain of the patient. It helps in reducing that. They are more at ease with their destiny, I would say, or whatever's coming forward to them. So it makes it more acceptable to them. And that makes things very easy for them.
Yes, absolutely. Thank you. And I think it's really important for families to know that I think they should just ask. And if it's a certain mosque or a certain imam that you want, or a certain person, they can always arrange something for you. You just have to ask. And I think it's really important that you discuss as a family the care, the support that you want, and bereavement services also there. And I think bereavement service is another one. This is really important for families that they can make use of, especially when you have young children involved or young people. And I think as adults, as Muslims, we have our salah and we pray to Allah. We know that. But then for young people who have grown up in this country, it's really important that they get that specialist support, and of course, with the deen as well. I'm going to move on to something different now. Well, similar about hospices, hospice care. In our countries like Pakistan or Bangladesh, we have hospices. But what I know from hospices in Pakistan is that they're not really like the hospices that we have here in the UK. Dr. Sadaf, I think, could you tell us something more about palliative care that you would like to see in Pakistan, and then Dr. Lodhi as well?
Sure, thank you for that. So yes, I completely agree, and there's a lot of evidence in articles and journals as well that palliative care is almost non-existent in underdeveloped countries, and unfortunately, Pakistan, Bangladesh is one of them. India is a bit better than us. They have some good quality palliative care in Kerala, and they're advancing in that. Um, but sadly, so if I talk about, because I'm from Pakistan, so if I talk about Pakistan, we hardly have one or two private institutes who have some degree of palliative care. Other than that, the rest of the country is just suffering. So 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 number one, people have to pay money. So they have to pay to get the medical service. That's number one. Number two, they are very poor. So a very big percentage of our country is under the poverty line. That's the other thing. And number three, even if they have the money to pay for the medical services, then there are no expertise to deal with these people who are in the last stages of their life. So they are told by the doctor they are not curable anymore, hence they just need to take their loved one home and just die at home. So we come across many people personally, and I'm sure you must have come across as well. I had somebody calling me that, my uncle is vomiting blood. What do I do? And so my son is having fits. What do I do? And doctors are telling us to take them home. There's nothing for them to offer, and people are dying in misery. Literally misery. So yeah, I don't know. So few of us here in UK and a few members from the other parts of the world together, we've joined to work on this, and it's called something we call Shine Palliative Care Project, and it aims to basically improve the awareness around palliative care in Pakistan, provide education and training, to our doctors who are already there. And the nurses, and then hopefully one day set up these palliative care units and the community-based services to help our nation, which is actually suffering a lot.
Yeah.
Do you want me to add something to that? I think I agree with
Yes,
everything
okay.
Sadaf said. Sadaf has been the brainchild behind this project, and she is the motivation. She actually motivates all of us and keeps reminding us that we need to be involved in this project. But actually, it is something that is desperately needed. As we've said, very few palliative care services are available in Pakistan, and I think in terms of our goal, the first goal is we need to raise awareness in the general population. And we've talked in the general population in the UK because it's limited awareness even in the UK. So when we're talking about awareness in a country like Pakistan, it'll be even less. The next most important, and for me the most really important, is I'm a great believer in education, is education. And education starting with medical students, postgraduate, but also nurses, pharmacists. We need to make sure that health professionals are there who are able to look at these patients who are having these symptoms, diagnose them, and treat them. So in this respect, at the moment, we are involved in two universities in Pakistan. One is NUMS and one is Khyber Medical College, involved in a certificate in palliative care. And I think this is the start. Initially, these were supposed to be done face-to-face, but because of COVID, they're being done remotely. And maybe this was a blessing, because the advantage of doing things remotely is hopefully we'll be able to attract more people and raise the awareness and educate more people. So this is at an early stage, but eventually, as Sadaf said, we would really like to have some sort of palliative care unit set up. There are lots of challenges, and challenges in, as Sadaf said, not only in the financial challenges of patients being able to get drugs, but even in the availability of drugs. So, for example, drugs that we commonly use, which are really important, you cannot get over there. So there are lots of challenges, but I think this is an important area for us. One thing that is without doubt is death is inevitable. So we know people are going to die, and we also know a lot of people die a very difficult death. It's important to make it as comfortable as possible. We have a whole population which doesn't have access to the services. So we think it's really important to try and do whatever we can do to help. So we're very determined, and inshallah, we'll have some success in this project.
Inshallah, definitely. And I think it's a struggle here in the UK, highlighting the fact about palliative care with people and educating them. And then often what you hear from extended services is that, oh, maybe the people are not educated enough. But then I come across healthcare professionals who even not really fully aware of palliative care, and then it's like, okay, so it's not really. I think if you don't encounter a situation, you will not know what palliative care is or what end of life care is unless you have the experience, or come and volunteer for us for Eden Care, and then you will learn more about it, inshallah. But I think definitely for myself as well, until I didn't work in the hospice, I didn't realize how difficult it could be, what sort of dynamics there could be. I mean, dying, you often think, like, for example, motor neuron disease. I think once when I seen one of the patients, I think it really shook me up, thinking like, oh my God, like, what if I'm in that situation? So I need to plan. I need to think of all sorts of things. And I think a final message, both of you, what you would like to give out to people. Dr. Sadaf, you first, or Dr. Lodhi? Any of you two go first?
Sadaf,
Okay,
would you like to?
yeah, thank you, Dr. Lodhi. So I guess my message from my heart to the rest of the world is join hands with projects like Eden Care and Shaheen Project. People involved in these projects, or people who have started these projects, are people who have been actually hit themselves. So like with myself, it was my promise to my dying mother that I'll make sure palliative care comes to my country. So, and then hence this is my struggle till death comes upon me. So it's not about just living for our own selves. It's about living for other people, living for others, and making sure that we make a difference in somebody who is now leaving this world, and that difference will actually not only impact that person who's leaving the world, but the entire family will then live with this memory for the rest of their lives. So we, I mean, human beings around us have a right upon us as clinicians that we make them as comfortable as possible. And people in our countries, where Pakistan and Bangladesh we come from, we need to give back to our countries.
Definitely. Dr. Lodhi?
I think Sadaf summed it up very well. For me, palliative care is the essence of humanity. I think, yes, we try and cure people, but in terms of when I have students, one thing I always tell them is people will always remember, relatives will always remember the care you provided to their loved ones at the last few stages of life. And it's something we have to try and get right. We've looked after them for so many years. We've done the best we can. Surely at the end stages, we've got to make an even more determined effort to make them as comfortable as possible, not just for them, but for their family members. We're trying to do that in this country, but we also need to try and help other parts of the world. As Sadaf said, Shaheen Palliative Care Trust is trying to do that in Pakistan. All of the people who work on it are volunteers. It is a charitable organization, just like the Eden Project. And I think it's incredible to think that we have such good charities which are trying to improve these services. All I can say is, if you can volunteer, please do so.
Thank you very much. Definitely, inshallah, I'll make dua that Allah subhanahu wa ta'ala blesses Shaheen Palliative Care and Eden Care and all the other charities are doing such great work. And I think you got to have your heart in it, wholeheartedly come and support, because this is you're dealing with people who need that love and dying people always is so rewarding. I always find it so rewarding, and I thank Allah subhanahu wa ta'ala so many times that He's given me the chance to work with people like that, and I learn so much from them, and it makes you appreciate your own life, and I think we become better people. I would like to say, please do donate to 13 Rivers Trust. We're relying on you. And thank you so much, Dr. Sadaf and Dr. Lodhi, for coming on my show. I can't thank you enough, because this is something very close to my heart. And you've made it very easy with your words to explain everything. Thank you very much.
Thank you, Naureen,
Yeah.
for having us. Thank you.
Thank you very much.
So this will be the end of my show for today, but don't miss my show next week. It will be about mental health, and I'll have some special guests next week. And do donate, please, because we're relying on your donations. Your support is very important. Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa natubu ilayk. Jazakallah khair.